Welcome to this tutorial presentation on how to perform an advanced search in PubMed. We begin with some basics before commencing our search. It is necessary to become familiar with Boolean operators that use the conjunctions and, or, not to narrow, expand, or limit searches respectively. Using the Boolean operator AND retrieves articles containing both the terms Crohn's disease and inflammatory bowel disease as represented by this intersection. Using the Boolean operator OR expands the search by retrieving articles containing either the term Crohn's disease, inflammatory bowel disease, or both. Using the Boolean operator NOT limits a search by exclusion. For example, articles containing inflammatory bowel disease without the term Crohn's disease would be retrieved. Another important consideration before beginning a search is the crafting of the clinical question using the Pico framework. P is the patient or problem, I is the intervention or exposure, C is the comparator, and O is the outcome. Typically, a Pico question is developed from a clinical scenario. Once you identified the components of the Pico question, rearrange them into a concept map using synonymous terms comprised of keywords and medical subject headings, or MESH terms. Using the MESH database in PubMed helps identify these terms, as we will see momentarily. Let's examine this concept map more closely. In the clinical scenario, a 23-year-old male presents with Crohn's disease and discusses the possibility of a surgical procedure to help gain remission and a better quality of life. He claims that his current medication has many adverse side effects. In this case, we are leaving the comparator blank since there are many medications to treat Crohn's, and the focus here rests with the surgical option to obtain remission. When conducting the advanced search in PubMed, work through each column individually using the OR Boolean operator. Once completed, connect the rows with the AND Boolean operator. Lastly, note the additional column Refine. After performing the initial search, further limits may be applied to obtain more relevant retrievals. In this case, the limits are set to randomized controlled trial articles only, published within the last 5 years. Since Crohn's disease presents in children and adolescents, this particular search focuses on the adult population. In PubMed, the sidebar panel contains these options, so there is no need to apply Boolean operators. We will now head over to the PubMed homepage. Before getting started, log in and select Create a MyNCB account. This account is free and allows you to save search strategies and retrieve article citations. Note that most of these citations include an abstract, and some even have links to download the complete publication at no cost. As mentioned earlier in the tutorial, terms to construct the Pico concept map were taken from the medical subject heading or MESH database in PubMed. Scroll down the PubMed homepage and select MESH database. By typing Crohn's disease in the search bar, you will see that Crohn disease is the MESH term. By selecting this MESH term, a list of keywords and other related MESH terms arranged as a hierarchical tree is displayed. For the purposes of this demonstration, Crohn's disease and inflammatory bowel disease were selected as the patient problem. Similar methodology was used to determine the terms for the remainder of the Pico map. To begin an advanced search in PubMed, click on Advanced. Recall from the Pico concept map discussed earlier that we first work down the P column and join the terms Crohn's disease, a keyword, and inflammatory bowel disease, a medical subject heading or mesh term, with the OR Boolean operators as follows. Click Add, and notice that the term is now entered into the query box. Then we're going to add the term inflammatory bowel disease, and since we're working down the column, we need to join with the OR Boolean operator. So in the drop down, we are going to add with OR. Then click Search. And if you notice, we retrieved almost 115,000 results. Perform the same procedure with the I or intervention column. So we go back to Advanced, and we're going to start the interventions, which include surgery, surgical procedures, and I'm going to assume all of these are keywords. Again, we add with OR, resection, and laparotomy. And click Search. And here we almost have 5 million results that have been retrieved. Once again, repeat the procedure for O, or the outcome. It is not uncommon to omit the comparator when performing a Pico, since we are only interested in the intervention, which is the case here. So we go back to Advanced, and we're going to do our outcome terms. In this case, curative, and remission. And we will join those once more with the OR Boolean operator and search. And notice we get 230,000 results, nearly 230,000 results for this particular search. We can now narrow our search results by joining the Pico with the AND Boolean operator. Go back to Advanced, and if you notice down here in the history and search details, our individual searches that we have just done previously have been recorded. Connecting them is fairly simple. Begin with search number 1 and add to the query box. Click Add Query, and we repeat the process for search number 2 and search number 3. We want to add with AND this time. Click Search. Note how the search results are considerably less than those individual searches that we did with OR. This means that the records returned are not only less in number, but they are more targeted and relevant. Finally, let's apply the refinements from the Pico concept map. As previously stated, this can be done using the PubMed filters located within the sidebar. The refinements we said we were going to make include randomized controlled trial articles only, publications within the last 5 years, and adults greater than 19 years of age. Note that Crohn's disease can also be a problem with pediatric and adolescent patients as well, but we want to restrict to adults. To do this, we click on Randomized Controlled Trials, Publications within the last 5 years, and here it says infant birth to 23 months, but we want adults. So I'm going to look at additional filters. Age. I'm going to click off that one, and I want adults 19 years and older. Click Show, and then select the box. And notice how much the results have decreased. So these would indicate highly targeted and relevant results as well. We now want to save the search strategy and the final list of article titles to peruse more thoroughly at a later date. Remember, most articles come with an abstract, and in some cases the full text. To save your work, you must be logged into your MyNCBI account. Recall that creating a MyNCBI account was discussed earlier in this tutorial. As you can see from my username that I am already logged in. So to save the search strategy, go to Create Alert, and the name of the saved search is the whole search strategy that we had in the search history boxes, but you can shorten all that and give it a name. So I'm just going to call it CD for Crohn's disease. And you also have the option, if you want new updates for this particular search, to be emailed to you, and you can specify certain times that you want these, whether they're weekly or monthly or bi-weekly. But for my purposes in this tutorial, I'm just going to click no. I do not want any updates. So I'm going to save this. So now my search strategy is saved in my NCBI account. The next thing I want to do is save all the article titles, all 49 results. So that process requires you to click on Send To, and we're going to click on Collections. And I want to create a new collection. I want all the results in that collection, not just the displayed one, because it may not have displayed all 49 results, and it'll just have the ones that are on the screen, and I want all of them. And I'm also going to name this collection CD for Crohn's disease. And I'm going to add. Let's take a look at my NCBI account. So I'm going to click on mine, and I'm going to go to my dashboard. Here you can see the saved searches and the collections, and remember I gave them the same name. So if I looked at my saved searches, I'm going to find the whole search strategy up in the search bar. If I click on Advanced, and notice it tallies everything I do in my search procedure, I'm going to choose the last one because that's the most recent. If I click on Details, it shows me the exact search procedure that PubMed did, and this could be very useful, especially if you decide to do a systematic review and you need all the different fields. PubMed will do that for you. Now let's go back and look at the collections. So here are all my results, all compiled nice and neatly, and then I will be able to go through each of these individually at my leisure and choose what articles would be of interest for my particular research. In concluding this tutorial, I would like to call your attention to the private setting in the collections. If you would like to share the results of your search, you can convert this setting to public. This will create a link that you can send others. Once the link is selected, the collection list is displayed. You may also revert back to private setting if desired. Thank you for joining me in this tutorial on how to do advanced searching in PubMed. If you have any other questions, please contact the Lincoln Memorial University Carnegie Vincent Library.